So when we think about the pros and cons of weight loss medication, I think there's kind of two ways I think about that. One is the big question. Should I use any medicine for weight loss at all? What are the pros and cons of adding any medication? And I think the clear advantage, the main pro for using a weight loss medicine is it allows you to change the environment. It allows you to change the rules, and it may allow you to lose weight where the things you've tried before haven't worked. On the con side, there are a few ways I think about that. There are folks who, all of us, I think, who would like to find shortcuts. I don't think it's inappropriate to look for shortcuts. The problem I think we face is that in treatment of diabetes, in treatment of obesity, metabolic dysfunction, I actually don't think that shortcuts work. So the problem with using a weight loss medication is if we only do that, if we use it as a tool to lose weight, but we don't do any of the other parts, and we'll talk about the other parts, but if we use the drug without doing any other changes in diet, any changes in exercise, any other behavioral changes, then two things fall out of that. The biggest one that I worry about is that these drugs will generally help you lose weight, but they'll help you lose fat and muscle. So I think that's part of the problem. I should have said this earlier, but I think part of the problem is that weight loss isn't really what we want. What we want is fat loss. We actually don't want muscle loss. And the older you get, the worse it is if you lose muscle because it's harder to put back on. So weight loss is a problem if what we're losing is muscle and fat. And if you only use an appetite suppressing drug, or if you only use a GLP-1 drug and you don't do any other behavioral change, you tend to lose both muscle and fat. And if you ever stop taking the drug, you will gain back. And if you didn't change your habits, you'll typically gain back fat. So my biggest fear in using weight loss drugs is that if they're only used as a shortcut and they're not used in conjunction with behavioral change and lifestyle change, and particularly changes to diet and exercise, my fear is that you end up worse than you started, and that some number of months or years down the road, you end up as a person who has less muscle, but who weighs the same or weighs more. And then the individual drugs have different things they can do to us that are adverse effects. The appetite suppressing drugs are stimulants. They can create seizures. They can cause high blood pressure. They can cause palpitations. They can make us irritable and angry and cause insomnia. If you look at the GLP-1 drugs, the adverse effects associated with them directly generally are related to the gut. The worst is pancreatitis. It's thankfully fairly rare if we are careful in how we up-titrate the drugs, but pancreatitis is a horrible thing. It's basically the pancreas digesting itself, and to get it to stop is hard. Otherwise, the gut side effects are more manageable, not as dangerous, but they include nausea and vomiting, sometimes diarrhea, more commonly constipation. And again, with any of these drugs, my biggest fear that they're used in a way where we're not measuring for the things that we care about. So if we care about muscle, I think we need to know what's going on over time as we're using these drugs. I think we need to measure what's going on metabolically. I think we need to screen for pancreatitis if we're on the GLP-1s, because if we don't look, we can kind of get into trouble and not know. So I'm a fan of doing these in conjunction with a health coach or a trainer and doing some measuring both in the lab as well as body composition measurements so that we know what's going on.